So I think we are extremely privileged to have you as the director for Hope's um, nursing program. I'm sure you are the ideal person to lead this meeting and so show us what is really important when to score an abstract. So I don't think I need to say any more. Your credentials speak for themselves. So over to you, Marilyn.
Great. Thank you, Jocelyn. Two of them know me very well because they're part of GLOPA as well. And what we'll do, everybody, is tape this. And then it's going to be a very short discussion. I'm going to go off video so nobody loses because of that. What we're doing is scoring the PSYOP abstracts for this year. And in talking with Dr. Heal, I had told her about an abstract scoring rubric that I use for PSYOP for the Hawaii one. We use it in Ottawa as well, and when we were in Spain. And she thought it was a great kind of more comprehensive rubric for us to use. And so they've adapted it in this beautiful, in a few days, they have adapted this beautiful reviewer site, a portal, as you see on the screen. And what we've done with the apps, so you'll see when you come in, it'll welcome you. You're going to be getting a link from PSYOP Africa. There's a home, which is this site there where the abstracts actually are. And then the rubric they put right up here. And I'm going to go over the rubric first and then go back to show you how to score. But I came up, and can everybody see the rubric? I want to make sure. Somebody say a yes. Great. So we came up with this rubric because I think that important part of abstract review is to pull out and select the best abstracts. And so when you have a 0 to 9 scoring system, it really doesn't give you any variability in the scores. So you're either going to have all up at the high end, or you're going to have a few that are 0 or 1, but the most of them are going to get, a good score. So this helps us tease out the best of the best. And you'll see this, you might want to print it and put it beside you, or you can flip back and forth, but you're going to be reviewing, and I'll go in and show you each of these components of the abstract that you're going to look at as a PSYOP Africa reviewer. So if we start with the title, they get 3 points if it's excellent, it's very accurate, it's concise. You can read the title and know what that abstract is about. It's a bottom line. They get a 2 points if it's a little bit lacking. Perhaps they didn't say exactly what they were going to do. It's a little bit vague. One then is they left out some key components, like what the population was or what the variable was, or you're not even sure if it's relevant to peds oncology. And then 0 is an abstract that doesn't make sense. And hopefully we won't have any of these. But as you start to familiarize yourself with the rubric, you can see, and it does come easier after you do 3 or 4 of these, it kind of starts to be natural, like, oh, this title is perfect, or, well, it's missing a little bit, I'm not going to give them the full 3 points. Then you go on down to background. In the background, again, remember, it's supposed to be 300 words or less. So there's not a lot of room for you to be, extensive in writing. Many of you have written abstracts, and you know that there isn't a lot of space in these. But the background really does, it's excellent. The context there, you understand from reading those 3 or 4 sentences in that background section that it's concise, it's clear, you know exactly what's going on. 2, it's a little vague, but it's pretty clear. But there may be something that you're questioning, but it's not quite stellar. And again, you can tell this is a judgment call. You are the reviewers, you're the experts. And so it's going to be, a judgment call. A 1 is you read that section and you're not sure what it's all about. You're really not sure, but there's enough there to give you an idea, but it really is only partially, conclusive of what it's about. And then 0 is you just don't really understand at all what they are doing. And hopefully we won't have many of these. Most of the time it's a 3 and a 2. However, sometimes there's a 1 because you just don't really think they've done a good job telling you what they're going to do. And the reason why, if you think about it. Methods then is how they did it. And so if it's a research study, you want to see some kind of discussion of the design, sample, how they sampled, what procedures they used, if they use instruments. If it's a practice education quality improvement project, then you want to know a little bit about, what it was, who was our audience that they selected, how they implement it, and how they evaluated it. Remember that methods is not your results section. So that's often where you'll take off points where they talk about the results and the methods. This is purely how they did it, and results is how they analyze it, if you think about it. So again, a 3, if it's really detailed, you have no questions whatsoever. Remember, again, it's judgmental because they only have so many words. So you can't expect them to write a 500-word summary of their methods when we only give them 300 words to do it in. So remember that in your judgment, that you've got to realize they don't have too much room for that. Adequate means they're described with adequate discussion, but maybe you're still questioning, okay, what did they use instruments? What was the sample? You have a couple questions. 1 means you really aren't sure exactly how they did it. There's missing big pieces. And 0 is you're just not sure at all how they did this study versus education project versus quality improvement, etc. And then results will depend again upon the type of study you're reviewing. If it's research, you'll want to look at the quantitative versus qualitative versus mixed methods analysis. Did they describe the data and how they analyzed it? Often confidence intervals are a little bit better for them to be using than p-values in a very short, concise abstract. If they did a qualitative study, do you see themes and categories that are summarized in the results section? If they did mixed methods, you'd want to see a statement about how they put those 2 together and infuse them. Systematic reviews, not too many people are going to be doing those, but if there was a systematic review, did they talk about the search results, how they did the search? And then if it's a practice education or QI project, you still want them to describe the data they collected, how they evaluated the project, and what they found. And so it's really important to see and understand what they found. So for excellent, the results are conclusive, they're easy to interpret. You understand what they did in the methods and what they found in the results. A 2 is, well, maybe they put something in there that wasn't about, like, an extra piece. I see this often in research studies where somebody has done, a 2-year, 3-year research study, and they want to put everything in the abstract, but you can't. And so they put something in there that might have been part of the research study, but it wasn't a part of this abstract. So keep it concise. And if you see something there and you go back up to the introduction and they haven't mentioned it, you might give them a 2 there. A 1 could be that it's really quite discerning in that you're not sure what they're saying. So 1 would be, well, there's some analysis here, but it doesn't really tie in to the methods perhaps, or maybe it didn't tie into the introduction, and so you'd give them a 1. And a 0 would be, there's really no data there, and there's really nothing to tell you what they found from their project, from their research study, etc. And then conclusion, again, 3, 2, 1, 0. Is it concise? Does it match the part of the title, the introduction? Does everything that they've done in the abstract up to this point really match the conclusion? And often, believe it or not, you see conclusions that, well, where did they get that conclusion? They didn't analyze that. They didn't study that. They didn't implement that. So it really needs to be in alignment with the rest of your abstract. Adequate, they would get a 2, and we've even given you some things that maybe they're missing, back to reflecting on what the aims or the purpose of their project was. Maybe they're supported by results, but it could be strengthened because they just have some things that are a little bit inconclusive. When appropriate, defines the implications for their field. So you want to see something that's related to this study really helps us, improve the care of a child with fever and neutropenia, or, it really does give you a statement about the implications for your field. Then for needs improvement, we see that, they're really having less and less of things that are clear in the conclusion. And then if you do a 0, they're really not reporting or in alignment with that as well. And then 6, the next to last piece you're going to be looking at is interest and appeal. It's excellent, it's interesting, it's novel, it has an impact, it has broad appeal. 2 is it has general appeal, but maybe you've seen a lot of these before and there's nothing really novel about it. You might give it a 2. 1 would be really you don't see anything that adds to the appeal of the individuals that are in the specialty. And then 0 is you don't really see any application to the peds oncology community. And then 7, excellent, is it tells you exactly how it impacts the field. And again, these 2 are not sections of your abstract. These are just for you to think overall, does this abstract have interest and appeal? Does it impact the field? And then, 2 points, pretty adequate, but maybe not a new area of focus that adds to our knowledge. 1 would be, don't really see a limited potential for a significant impact on the field. And 0 is you just don't see any area whatsoever that is adequate. A 0 would be, I had one last year that was on newborns. Great little abstract, but had nothing to do with cancer. So it didn't fare well in this critique here. You don't have to worry about adding these up. It just does it automatically, and I'll show you in a minute the final scoring and how to score. But any questions? We've made it short and simple and concise, and if you follow the rubric, you'll be able to really show the variability that we want to show in our abstract reviews, from a score of 3 maximum down to 0 of really not having the components we want to see in the abstract. But before I go into how to put it into the system, any questions? You can either open up your mic or you can chat before I go on to that.
Marilyn, I'll just quickly start because I've already started scoring some abstracts for the medical side. So do you want to just tell the nurses, like, sometimes you get people that have a background that is extensive and they talk about a lot of things, but it doesn't really come to the point of what the background is, because for instance, Professor Giel did a really, really lovely talk about how to do an abstract, and she said, tell people what you do are going to talk about, where is the gap in your research, and what is the aim or objective, and that is the main themes. But how do you feel, how do you score it when people have this really long backgrounds that you kind of sometimes think, where are they going with this?
I mean, really good point. And once you start doing a few of them, and you'll just get into a rhythm. If a background is really long and extensive and has a lot of stuff in it, I feel like they're trying to fill in space from what they really did. And so more is not better. So if you read a background and you go, I'm not sure what they're doing in this study or in this project, I would not give it a 3. I would go to a 2. The excellent is the context of that background section is based on what you see in the title and the purpose of this project. And if that's not there and clear, don't give them a 3. You're going to have to go to a 2. If you read that great extensive background section, say it's supposed to be on something like mucositis, and you really don't even know anything about mucositis by the time you've read that, it's more about childhood with cancer and all that, you might even give them a 1. So it's really, perfect point of keeping it focused. Think that I want to read the title. I want to see the title in my background. I want to see then that my methods are asking the question on how to answer the question that they've raised, the important purpose of their study. And then I want to see my results reflect, what I actually am saying I'm collecting in my methods. So great question.
So leading on to that, you just said that the results actually connect with what they're doing. So let's say somebody said, the objective or the aim of my study is to look at the epidemiology, and to determine the outcomes for a child with a specific kind of cancer. So what if in their results section they only talk about the epidemiology, or they only talk about the outcomes but haven't spoken about the other objective that they've mentioned? So do you say, okay, well, this is incomplete results, and then mark them down?
So I would mark them down. That's why I always go back and say, wait a minute, what data did they say they collected? And I want to see if they said exactly what you were just reviewing, that we're going to look at the epidemiology and outcomes. That's 2 things. They better both be in the results section. If they're not, I'll probably give them a 2. If it's really vague and they didn't have good, much in there, I might even give them a 1. But that's why when you're writing abstracts, don't tell them any more than you actually are going to be able to accomplish in 300 word abstract. Write it so maybe you just pick one of those, the epidemiology of certain type of cancer. So I would mark them down because they haven't really completed the results section. And I'd probably give
So
them a 2 or 1. I wouldn't give them a 0, because 0 means there's nothing there that you can interpret.
So then the last part that also leads on to this. So sometimes people are so enthralled by what they had proven, that in their conclusion they say a lot of conclusion, and then they add things that wasn't really proven in the results section. So
Exactly.
what do you do with that? Because sometimes I see conclusion and go like, but you didn't even say that this was an aim or an
Yes.
objective, and then you didn't give the results that supports the statement that you're making in the conclusion. What do you do with that on a scoring basis?
Well, and I mean, these are exactly the things that you're going to encounter. And so, and I mentioned that your conclusion for abstracts that aren't excellent, sometimes you go, I don't know how they got that because that wasn't the focus. A lot of times people, I say, give up and get tired when they write their conclusion. And they might say something like, we need to cure childhood cancer in Africa. Well, what did that have to do with looking at specific type of symptom that they say they're going to evaluate? I would, again, if the conclusion doesn't really match the methods and the results section, and they throw in things that they really didn't study, you're going to have to take them down to a 2 or 1. If 0 would mean nothing there makes sense. But I'm always trying to give a few points to people that if they're missing things in the conclusion, or the conclusion's kind of going way out there in that too broad domain that doesn't say anything, you would want to use your judgment and give them a 2 or a 1. And I noticed there's some dots. I may have to send you, it looks like maybe it got cut off because there's supposed to be 4 things here. So I'm going to send this right back to you as soon as I get off, Jocks, that I think we're missing some of this box. because it says at least one of the 4 are missing. There's only 2 dots there. So I'll get that to you and maybe you can throw it up real quick after the meeting.
Do you mind including Professor Gill, because
Yes, definitely.
she's head of the scientific committee, so she can also see that it's happened.
Yes, I will send it
Thanks,
to both.
Marilyn.
But what other questions? Those were great questions because those are the things that are going to come to your mind. Renelle's got her, yeah, and yes, I'm so glad you're here. Renelle. Can you, I see your hand, but I wonder if you don't have audio, you can always put it in chat. 'Cause we can't hear you. Well, hopefully what I want to do, hopefully we'll get her back on is if you guys are ready and don't have questions. I mean, my advice is the rubric is here. We'll get the one to make sure it has that missing box. Just print this or go back and forth with it. It's right here. It's lovely. You can open it up on another, button, and then read this and go, okay, it's excellent. After you do 4 or 5, I can guarantee you that you're in the rhythm. You're like, okay, no, this is different than the last one. It's inadequate. Or, oh, this is to the point. I don't see anything missing. But once the rubric is here, and then this is just lovely. The abstracts are on this button. And just give my computer a minute to get to it. So I'm just like you guys, I have problems with slow computers. Turn off my mail, that might help. So I wanted to show you. So then this is your screen. And Jocks, if I'm saying anything wrong, you let me know. You can search for a certain one, but really your abstracts are going to be down here. And ignore, I don't know what this is yet. Ignore that. But your abstracts to review are going to be listed here. And you see the author, the title, it's going to be a platform or poster, and then you will go to the review button. If you are a conflict of interest, meaning you work with that person or you help them with that abstract, you just don't do it, just skip it. But you go into review and you're able to click on each of these buttons. You see the title, you see the themes. This is a nursing one, nursing education. You see the authors then, so you can see where they're from and if they're nursing. And then the abstract here, you will click on it and it's a view as a PDF. And I often just click on it and open it. I just upload it here. Get my thing out of the way. And where is it? Here it is. It's a download. So here then is the abstract you're reviewing. So you would review the background, there's the methods, results, and conclusions. And so if you have your rubric next to you, you can go back and forth and say, okay, yeah, it's very clear or it isn't clear. So if you look at this one, we aimed at assessing knowledge of oncology nurses on pain assessment and management. So I'd want to see knowledge on assessment and management throughout all of the other categories and not go off on other things. So once you do that, then you can see if there's any additional information. Usually there isn't. You go to review submission. That's your job. You click on review submission. And here's this lovely drop down. I'm going to give the title a 3, 2, 1, or 0. And you would do that for each one, background and names, 3, 2, 1, or 0. You don't have to tally them up. And Jux, I'll refer to you on this, but I only put a reviewer note in here if it's just like an excellent one or why I said it's not appropriate, but I don't put reviewer notes because we usually just use the scores in Big PsyOp. So I don't put any comments to the author because I don't think it's coming back to them. But you might want to say,
So
yeah, something
Marilyn,
like
if
that.
you see at the bottom, I also don't really use that. You can see you can send it to back to the author
Yeah,
to review, but I prefer not to do that.
yeah,
If you feel you need to validate why you gave a really bad mark, so for
you
instance, I
put something.
scored a um, abstract yesterday that I think they're still doing their data or analyzing it. So, for instance, they had said very vague stuff and stuff like that. So, or like I asked, if people had put conclusions that is not proven by the results, you know. So it's just so that people understand why you scored really badly. Because obviously we are rooting for everybody to do really well, but this is also an exercise in for people to learn from.
Got it.
But I obviously don't write books and books about it. It's just something like um, conclusions not supported by results, or results are no qualitative or no quantitative results in a, you know, when you expect it or something like that. So I agree with you. I mean sometimes the scoring talks speaks for itself.
Exactly. And so I'm glad that that's what you're recommending. So what I would say to you as reviewers is you would only put a note there if you scored it like a, really low, like you gave a lot of ones and zeros, that this isn't appropriate to the field, or there was didn't no logical flow or something like that. We want all abstracts to be, accepted if there's something that are going to be contributing to our science. Ronell just asked a question: was this rubric focused on, high-end countries, or is it used with big PSYOP for all countries? And it is. This is something, and that's why I think it really gives individuals from low income countries more of a variability in their score for more to be accepted, because it really does allow you to focus on each component. So it was designed for global, and certainly for those that haven't written abstracts before, because as you see, you can still get a 3 or 2. A 1 and 0 are going to be for those abstracts that really don't, as Jock's saying, don't make sense, or don't flow well. So my recommendation is do the score. If you have one really low, you might just say the rationale of, this one just didn't make sense, or really high, exceptional abstract. You're not going to send it back to the author for editing. This is our scoring system. So Ronell and her group can move forward on accepting abstracts for presentation and posters. So don't do comments to the author or return. One thing, do know, and at first I'm like, I don't know how to submit. See this little teeny tiny little button? You cannot submit without clicking that, and then you will submit it. And that's all you have to do, and go on to your next one. Don't have to go up here. Then it'll tell you it's submitted. So don't forget this little button. If you're like, I don't know how to submit it, doesn't seem to be saving, click that little tiny little thing, and then you'll be able to do. And that's one of the things I found yesterday, because Jocks, I've been doing mine too. Um, but questions on that, it's a lovely scoring system. It's really better than what we have for PSYOP, big PSYOP. So I commend you guys for putting this beautiful thing together. But let me throw it out to the ones that are here with questions on your job.
Can I, Marilyn, I just want to just add to what you've said. So, Ronell, when the scientific committee sat down, we understand that people in Africa might not have as much experience as people at the International Congress. So we really wanted to have something that gives people all their opportunities. So if you look at the rubric that you can use that's for instance, SciP International has also a very short rubric where it's like if you have 0, that it's obviously rejected. 1 is a bad poster, or idea, or a very good poster for like a case study that's really interesting, would normally score around 4 or something like that. Whereas something that would make a really good oral presentation would then score up to something like 8. And if you really think this person should get the prize, or this is like innovative, that goes to 9 and 10. So there is kind of like it's really a limited scoring. So I really enjoyed yesterday while I was scoring to see that the people that really told you in their abstract what they wanted to do, they were clear and concise and not giving a lot of unnecessary information. They scored out into the 80s, whereas the people that really are middle of the road would mark out as something a high 60, but there's a big variability there that really helps people get to the oral presentations and not being thrown out by somebody that just did a little bit less but not as stellar.
Yeah, very well said, because Renell, this will help us help those individuals that may not have total, writing skills or being able to be, as concise as they want to be. So they'll get more variability in their scores because maybe their background wasn't as stellar, but their methods and results were just clear as anything. They'll have ability to make a better score than just a 0 to 9. 0 to 9 doesn't tell you much of anything. So that's why I love this, and it will bring the ones that are the best that you want to showcase up to the top, and then you'll have a lot that may fall into the poster session as well. And again, I'm not sure what you'll do with that, but very easy system to go through. Make sure, as I said, you will score each one of these. You'll do complete. Do not score anything that people that or that you work with, because we want to do that. Just leave it and go on to the next.
Marilyn, on
But
that point, can we just ask, just to be sure, when you are scoring afterwards, can you just send an email to Jennifer Gill saying, I recuse myself on these papers, and the first column on your left-hand side, you can see paper number. So so when you then write the email, say, I recuse myself on paper, this number, and this number. So when somebody goes back to see why you haven't scored some of the abstracts, they can just correlate with where you said, I recuse myself on those. And then,
okay,
yeah. It's just a double check so that people don't have to get back to you and say, why
why
haven't you
do you not
scored
score
those?
it?
And just assume that you recused yourself. Just confirm on which ones you did work on. So,
Good.
and then the other thing, Marilyn, is sometimes I feel very guilty if I give people a 1 or a 2. But what we must remember is that you're not the only person scoring that abstract. We've tried to have at least 3 people scoring the abstracts. So there will be an average between the 3 reviewers. So yours won't necessarily kill or resuscitate somebody's abstract.
And that's such a good point, because, even at grant reviewer level, you feel guilty, but you know that you can't give them the perfect score because it's bad, but you feel guilty. But you're right, it's an average. So as you're doing these, remember, I'm scoring how I think I should, from looking at my expertise and looking at the rubric, but it's going to be an average of 3 scores. So the pressure isn't just on you. And again, be liberal. I don't score really tough. This isn't like an NIH scoring session I would be in. I really look at what it could do for South Africa and our nursing, group there. And if it, go back to the rubric of, is it meaningful? Is it relevant? Will it have an impact? And keep yourself like in that groove. Um, so here's where now, if you know the person that submitted an abstract, do you recuse yourself? And Jux was just saying that. If you know the person, or you're, well, if you know of the person, that's different. But if you know that person well personally, or they work at your institution, I don't have people squirm in the big psyop. I say that's a conflict of interest, and I would recuse yourself. And for all global health people, I'll send our people that we know are the same. And I'll send in that list for all of us and CC you on it, so I've said that we're going to recuse ourselves from those. How many
Um,
app? Yeah,
Marilyn,
Jackson, to
I
that.
just want to be very careful with that statement because PSYOP Africa is obviously not as big as the international groups or even North America. So personally, I know about 80% of the people
Yes.
because I work in the research group, I know the majority of the people that's put in the abstract. Um, so otherwise I would not be able to score anything.
Or
So
anybody. How do
yes.
you want to
So
say it then? Yeah, you say
so,
it
so
better
what
than I
what
did.
what what I do is if your name is on the abstract, you know that you've worked on this abstract, or you have actually your name might not be on the abstract, but somebody had said to you, "Oh, quickly read my abstract and see if this is okay." I think that would be a conflict of interest. So if you are reading an abstract and you know that you have not had anything to do with this, just score it. Um,
Okay.
so,
Okay.
um, and maybe when you do recuse yourself on a specific abstract, maybe just next to it, just write that you either are an author or you had kind of helped them to polish up the abstract, one of those two, and then if our scoring is if we don't have enough people on the scoring, then we can go and say, okay, well, maybe you polished it. We can then swap it between the people that score. So just give us a reason, and we can see if
Okay.
that actually does denote a conflict of interest. So
Good.
yeah,
Well, then
there was
that
another.
changes things. Yeah.
Yeah.
So we'll only go with if you were on it itself or you helped with it. And then make sure, and I'm going to leave that up to everybody to write Jackson and Jennifer and Renelle probably, right? To say if you're nursing, I was on this abstract or I reviewed it. I'm going to recuse myself. Good.
Yeah. So there is a maximum. I saw there's a question. Do you have a maximum number of? So what we've tried to do is to spread the work evenly. So, for instance, if in the nursing there were, and I'm just going to take an amount, 50 abstracts, and we know we've got so many reviewers, we try to say, okay, you do 25 and another person does 25 and so forth. So, Marilyn, can you just scroll down to the bottom of this page? Because at the bottom, you can see there. So at the bottom, that will show you. So if you have gone through all those little tap pages, you have done all of it. So not all the abstracts for nursing then would be there for you, only the ones that you need to review.
Yeah, good point. And the other thing is 25 sounds a lot, but I can guarantee you once you're in the groove and you've done 3 or 4, it might take you, a good amount of time, like 30 minutes or so on the first one, or maybe 40, but then you'll get down to really reading it again, looking at your rubric to be able to do them in 15, 20 minutes or less once you get in the groove. Because it's either there or it isn't, the information. So you're not going to, just take it for what it says. Don't say, well, they meant to say that. They didn't say it. They didn't say it. So 25 sounds a lot, but often I do 50, 75, 100, and it doesn't take, once you're in the groove of it, once you get started, it comes. And Jocks, you've done a lot of these. Any comments on that as well?
No, I just wanted to relay. I remember with the previous South Africa, Professor Gill had to score 75, I think. She was allocated 75, and she did those in 4 hours, because she said at some stage you just do it. If you just sit and you do it without distractions, you really start going through it, you know. So I also saw yesterday, so the first one took me a while just to get into it again, and then I had to feed my cats, so the second one didn't go too fast. But after that, within like a half an hour, I had scored another five, you know. So once you get there, so I mean, if you have to score 50, then I think a good 3 4 hours tops. If you sit down and really put your head down, you'll be able to do those. So I mean, you are not a moderator or a promoter for somebody's abstract. You are just there to see if the elements are there. You're not there to correct their spelling or their word sentences or everything. It's
Exactly.
just you, just like you said, if the title says that, you look at what the main themes in the title are, see if I have addressed that in the background, and then see if it's reflected in the results, and then the conclusion, if the things that they've proven in those results are there. Now, I mean, if you think that this is really a worthwhile thing and you really think that this should be in an oral presentation, then I think the last two scoring ones can push up that for them, you know, like if it's really interesting, give him the marks for that. If you think that this will really change how you do your practice and so on, give him the marks, you know. So those last
Yes.
two are really, those are the ones where
Important.
you can really do that. Yeah.
Yeah. And Renell had a question I was just going to ask you to respond to, which is great. When are these due? Because I noticed we didn't see that in your email.
Well, no. So as soon as possible is always the answer. So obviously people need to know if their things have been accepted and so forth. So we didn't really want to pressure people because we all are busy and we still have to do our jobs. So we are really hoping that in next week somewhere all of it will be in. But I mean, if you can finish yours yesterday or last week, that is obviously the optimal time to do it. I mean, just think about it. When do you want to know your results to see if you're invited for an oral or not? The thing is that depends on that is, remember, people need to get their visas to come to South Africa. That takes some time. So the faster we can let people know, the faster we can go through that. So if I can put an unofficial date by the end of next week, you know, so that would be
Yeah.
really nice, so that we can start letting people know if they can come or not.
So let's try to go for a week. And word of advice, Jocks, just from doing this many organizations, if you don't give me a deadline, even if you give me a deadline, I'm going to sometimes wait till the next to last day. Now, I like to get them done, so I'll do them in the next day. But a lot of people wait till that last hour. So if you don't give them a deadline, you may not get your scores in. So let's say for nursing run now that everybody try their best to get them in
29th
by
of
next Friday.
February.
Yeah.
29th of February, so that we
Yes.
can finish this off by the
Yeah.
1st and 2nd of March, which is next week, Thursday and Friday. And those
Perfect.
emails can start flowing out by the weekend.
So
That would be, and
that would
I'll
be
give it through
perfect.
to Professor Giel, and she can also send that around.
Good. Yeah, so you have an extra day. It's leap year, 29th of February. And trust me, if you set, I would recommend doing a lot at once. Don't go in and do one or two because you'll be out of the flow. Once you get 5 or 6 done, you're in the flow. So do a lot of them and then maybe do, another few, 10 the next day, and then you'll get them done much more quickly once you get in there. Right now it sounds overwhelming, but it's only 300 words, remember, and don't try to read into it, as Jack said. It goes very
Yeah.
fast.
So Marilyn, the other thing I caught myself doing is, I mean, you can pick which one you do. You don't have to go in order, but
Yeah.
I'm warning you, if you say, oh, that looks like a really nice title, I'm quickly going to read that one and review it first. Don't do it. I know it's very tempting. Just start at the top and go down.
Yes. Yeah. Do, because you'll miss some. And then do make sure if you're on it or you reviewed it or read it for somebody, make sure you let them know that you're reclusing yourself. Because Global Hope, we have a lot of them in here, but if you didn't have anything to do with them, they're saying